is first. So the chair for the ankle assessment needs to, again, with your participant in, so I'm not going to demonstrate it with a participant in, I'm just going to show you how to set it up, and you can literally do both sides, both tests, okay? So it's best to start with the chair further back, so you've got plenty of room working. You don't need as many of the restraints in place for this particular test. The chair, however, if I just show you, this isn't essential, but it does help with the test. If your patient or participant has limited flexibility, can you see this handle here, just about? If you push that up, you can tilt the chair backwards and forwards. It just helps if you've got someone in a hip flexed position, just to bring it back. It goes back clicks. The less flexible they are, the further back it helps to bring the chair. So start it, that's upright, bring it back to position 1. Okay, to begin with. If you've got me, I'm very inflexible, I need to do more yoga. You might want to bring it back to position 2. I will let you know, your participant will let you know. Okay, this is very dependent on your participant. Okay? So underneath here, you might not be able to see it too well, but you've got the chair rotation position. This can be adjusted by this handle here. Okay? You don't really need to know that for this, but you will need to know for the next test. Okay? So that rotates 360 degrees. You need to bring the dynamometer head in front of your participant to position 0, okay? To start with, you might need to adjust this, but again, this is very much dependent on the participant you have and what they're comfortable with and their level of flexibility. You want to tilt the dynamometer attachment, or the dynamometer head, round 90 degrees to face your participants, like this. And then finally, almost finally, you have this screw here, which you tilt back to 50 degrees. Again, you might need to adjust this ever so slightly. You can see the position and the angle of tilt that the dynamometer head is at by looking at this gauge here. Okay, you can see it when you come round. So the next thing to do is to attach the thigh attachment. This height-wise is adjusted here. Okay, so very simple. This will depend on your participant and again their flexibility. Okay, and this, I'll just slide the dynamometer head out of the way for a moment. If you look at the front of the chair, there are 2 holes that this attachment slides into. Okay, so you pick the side you want to test first, slide the attachment in, tighten it up underneath the chair. And then adjust the height there, and you can adjust the angle, but that should be fine. Okay? But you can, like it says, adjust the angle of, oh, that's seized up. That should be fine as it is. The dynamometer head comes back to position 0, and you take the inversion, eversion attachment and attach it to the dynamometer. So remember, the dot on the attachment aligns with the dot on the dynamometer head. Okay. Remember, you can lock the dynamometer because at the minute it's freely rotating. Okay. So you can lock that in position by pressing the black button there or clicking the clicker of power, which lies underneath the PC. You screw that in place as you would on the knee extension tab, and then it's just a case of setting it up so that it's comfortable for your participants. So that might be adjusting the height of the knee attachment, adjusting the position here, but it really is a case of just fitting it around your participant, okay? And these are just the little things that you do just to make sure it's secure and snug, which are individual, participant dependent. You then tighten I'm going to take this off and be a bit of an arse so you can do it from scratch. You then tighten up the attachment by just pulling on these things here. They work on kind of a ratchet mechanism, like that. And make sure that that's snug. To loosen it off, you just pull it, flip, flip here, it comes away. Okay, it's really simple, and you can't, he says, really mess it up. There's a first for everything, I'm sure, but yeah, it should be fairly straightforward. So what I'm going to do is, just so that you get more practice with it, I'm just going to pause that.